One of the first tests we had run is an IgG food sensitivity test. This test determines the foods you may have a sensitivity or immune reaction to. If you are sensitive to any of these food groups, it could be making your condition worse, as it will increase inflammation in your brain and throughout your body. If you have the following symptoms, you could be suffering from food sensitivities: chronic pain, frequent indigestion, bloating after eating, frequent loose bowel movements, constipation, mouth ulcers or sores. And the only way to find out if you are suffering from any of these sensitivities is to run the test. Another test that we had run is intestinal permeability, used to determine if the patient suffers from leaky gut syndrome or LGS. LGS, or leaky gut syndrome, describes a condition of altered or damaged bowel lining caused by antibiotics, toxins, poor diet, parasites, or infections, and can lead to an increased permeability of the gut wall to toxins, microbes, and undigested food. Symptoms and conditions related to intestinal permeability issues are eczema, fatigue, joint pain, hyperactivity, multiple food sensitivities, psoriasis, acne, and irritable bowel syndrome, just to name a few. Another important test is the fatty acid test. An imbalance or deficiency in fatty acids is an important measurement of the body's inflammation and pain. Another test, dysbiosis. The proliferation and imbalance of unfriendly bacteria in the bowel is called dysbiosis. The cause of dysbiosis are antibiotic therapies, chronic poor diet, and low stomach acid. Toxins released from these unfriendly bacteria cause pain and fatigue. Symptoms such as constipation, bloating, excessive gas, and cramps are signs of possible dysbiosis. And uncorrected, dysbiosis can increase the risk for arthritis and autoimmune disease. Heavy metal and mineral testing. Heavy metal toxicity such as aluminum, lead, mercury, and arsenic disrupt the body's chemical reactions, causing pain and a host of chronic illnesses. This test also measures essential minerals, very vital for optimal function of your body. B vitamin status test. B vitamins are essential cofactors in many of the body's chemical reactions and necessary for hormone and neurotransmitter production. Suboptimal B vitamin levels may be due to poor diet, intestinal impermeability like we talked about earlier, poor stomach acid, and dysbiosis. Fatigue, mood and sleep problems, blood sugar problems, skin disorders, and a decreased ability to deal with stress are common symptoms of insufficient B vitamin levels. Detoxification test. This test determines how well you're able to rid yourself of external and internal toxins. Poor detoxification ability can elevate toxic levels in your body and result in fatigue, pain, poor concentration, and an increased risk for many, many chronic conditions. Neurotransmitter analysis. There are 4 primary neurotransmitters in the brain: acetylcholine, GABA, dopamine, and serotonin. Neurotransmitters are vital for proper brain function. A decrease in neurotransmitter level can cause increase in pain, poor memory, MS symptoms, foggy thinking, and poor sleep. Another test that we would do is a salivary hormone test. We can check hormone panels to determine if the patient suffers from low testosterone in males or low estrogen progesterone levels in females. Symptoms related to decreased hormone levels may include depression, fatigue, mental fogginess, mood swings, hot flashes, sweating attacks, weight gain, and decrease in physical stamina. Inefficient cellular energy production. Generalized fatigue, muscle aches, and poor memory are symptoms of poor energy production. The cells of our bodies can't detoxify or stay healthy without the ability to produce the proper amount of internal energy. This is a very important test. Another test would be for inflammation. We may need to test for inflammation in your system by testing homocysteine levels and C-reactive protein. Many patients suffering from chronic health conditions suffer from an inflammatory process. Just about every fibromyalgia patient I have ever treated suffers from some form of chronic inflammatory process. Oxidative stress test. This test measures how quickly your body is aging. Excessive amounts of free radicals in the body from smoking, pollution, alcohol, poor diet can cause a rapid cellular breakdown. In other words, premature aging. And finally, a comprehensive thyroid profile. Most tests done on the thyroid only involve TSH levels. This test measures not only TSH levels, but also total T4, FT4, FT3, and TPO antibodies. Symptoms of thyroid problems can be fatigue, weight gain or weight loss, depression, sleep problems, dry skin, hair falling out, and night sweats. Effective metabolic care can only be administered with a complete picture of the thyroid function. Now let's talk about some of the treatments that we have available. Percussion for scar tissue adhesions, craniosacral therapy, and soft tissue manipulations. Manipulation to restore spinal mobility and body-brain communication. Glutathione treatment, a powerful antioxidant used in most chronic diseases. Brain balancing, techniques to help balance the hemispheres of the brain for proper brain function. Assert, an energy technique used to desensitize the patient against allergic substances. Nutraceutical therapy, targeted supplemental treatment for nutritional deficiencies and healing. Oxygen, fuel for proper neurological function and tissue repair. EFT and ocular release, techniques for emotional wellness and stability.